Good morning. We are awfully glad that you are here. I'm just going to give a few housekeeping things before we start. I hope that that I got around to talk with everyone, but in case I didn't, if you notice your Post-it notes on your table, those are your action items for today. That's your quick and easy to-do list. If you have the purple ones, if you have a great idea or something you want to implement or something you want to research more, use your purple to write that down and attach that to your slides. Then if you have a person that you need to make a contact with or a meaningful conversation you want to have, use your orange for that. And then you have a ready-made quick action item to follow up on at the end of the day. So we're awfully glad you're here. Just want to do some accreditation slides. These are our disclosure statements for our speakers today. This activity has been planned and implemented in accordance with the accreditation requirements and policies of the Accreditation Council for Continuing Medical Education through the joint providership of the Medical Education Council of Pensacola and the Mercer University School of Medicine. MECOP is accredited by the ACCME to provide continuing medical education for physicians. The Medical Education Council of Pensacola designates this live activity for a maximum of 6.5 AMA PRA Category 1 credits. And you all know exactly what that means. And then our disclosure statement. In accordance with the policies of the ACCME, MECOP has collected disclosures from the speakers, planners, and reviewers involved in this activity. None of the planners or reviewers associated with this activity have relevant relationships with ineligible companies to disclose. The speakers do not have any relevant relationships with ineligible companies. So we're awfully glad you're here. Welcome to Mercer.
I know that makes y'all feel better. I'm Jean Sumner, Dean of Medicine. I have the distinct pleasure to introduce our Executive Vice President, Dr. Penny Elkins, who is Interim Dean in all things Mercer. Penny is an outstanding member of our Mercer family, leads this university, and it's a pleasure to have her. Welcome this morning.
Thank you. Thank you, Dean Sumner. Well, good morning, everyone. My disclosure statement is I have been at Mercer. I'm a very proud double bear, and I've been here for 25 years. I'm trying to come up with a code for that. Code, 1990, which is when I graduated. I don't know. But anyway, welcome to Mercer. We're delighted that you are here. Let me tell you on behalf of President Bill Underwood and the over 9,000 students at Mercer who are enrolled and making tremendous impact across 7 campuses throughout the state of Georgia, I do want to welcome you to this place, which we lovingly refer to as our historic Macon undergraduate campus. If you have not had an opportunity to look around our campus, it indeed is a beautiful and thriving campus where learning takes place. Not only learning, my friends, but this kind of work. So for almost 200 years. We're within less than a decade of celebrating Mercer's bicentennial, but for almost 200 years, we have engaged in this type of partnership work. The one thing that is distinctive about Mercer is we want to have high quality academic programs, and we do, but more importantly, we want our students to understand, whether they are in the School of Medicine, which we're going to talk about here in just a moment, or in our pharmacy school or our law school, that not only are they supposed to graduate and be very successful themselves individually for their families and their communities, but we expect more of our Mercerians, that we really do believe in partnership to make impact and partnership for purposes. We've done that ever since our founding. I want to say a special word of welcome to our Attorney General of our beautiful state of Georgia, Chris Carr. You certainly will hear from him in a moment, but I also want to offer a word of gratitude to Cammie Rice and your passion. That passion for purpose is what ignites Mercer, and we are all in when we can partner with an organization, with entities, with people like you who are passionate about creating change and solving real problems. I want to say that on our banners across the campus, this is the last word, but it speaks Mercer. you will see these orange banners. They're ubiquitous across all of our campuses, all locations in the state of Georgia. And they say in the parking lot, go look at them. They say at Mercer, everyone majors in changing the world. Yeah. And sometimes our students are like, yeah, right. Ha ha ha. Sure. Until they get here and they're like, oh, you expect that is true. And I said, we do. And we do. And so thank you for helping us continue to change the world together. Our 12 colleges and schools across those campus locations includes all kinds of, engineering and pharmacy and law and so forth. But I know why you're here, and that is because of our amazing Mercer University School of Medicine. We all believe, and she would not want us to say this, but we all know it's true. You talk about someone who is passionate for a purpose. That is our amazing dean of the School of Medicine of Mercer University, and that is Dr. Jean Sumner. Welcome her, please. Yep.
Well, thank you for that, Penny. We're just glad you're here today. The School of Medicine does focus on rural Georgia. We have a mission to educate professionals who will serve those populations and to do the research and inquiry and work with others to make rural Georgia healthier, and in doing so, develop models that are meaningful across our country and across the world. Most people on this globe live in a rural area. We forget that in Georgia. And though those flags outside say, we really mean, if you come here, you're going to serve the world. At the medical school, we serve Georgia, but we serve the world by showing people how rural health should be done. What we're going to do today is really unique. And what Cammie Rice and her organization has done is incredible. We all know there's an opioid crisis. We have to find a way to prevent that. And I've been completely blown out of the water by a mother on a mission to change the world. This organization does that, and each of you have that ability. So we're really honored to be part of this. We're grateful you're here. We hope you will become part of this organization and part of this effort. We're proud of our new life care specialist. We look forward to pinning them later today. It's a great organization and a great purpose. So thank you for being here.
I'm so excited to be here. I want to be a college student again, don't you? I want to go to school at Mercer. Okay, I have the honor to introduce a dear friend and our Attorney General, Chris Carr, today as our keynote speaker. In 2017, he created a statewide opioid task force that I'm a proud member of. And he did that to provide an infrastructure of communication between the public, the private, and the nonprofit sectors so that we weren't working in silos. This task force has been since cited as a national model and today includes over 300 partners across the state of Georgia to save lives. He's taking action against those who contributed to the crisis, including nearly 24 opioid manufacturers, distributors, and retail pharmacies by filing lawsuits and joining several national settlements. Here's the big part. He has secured more than $1 billion, that's a B, $1 billion for the state of Georgia. Can we give a round of applause for that? He worked with the U.S. Attorney's Office to prosecute a doctor in Savannah who was running a pill mill operation, prescribing massive amounts of opioids to patients through the work of his gang prosecution unit. He continued to go after the cartel and violent gang members that are trafficking deadly drugs in our community, seizing 15 pounds of fentanyl in Augusta alone, which is enough to kill 3.5 million Georgians. He recently pushed for passage of the Halt Fentanyl Act, which is just signed in July. He was there in D.C. for that. This permanently classifies fentanyl analogs as a Schedule I drug, assuring that traffickers are prosecuted to the fullest extent of the law. Please, I am so proud to welcome our Attorney General, Chris Carr.
Well, good morning, everybody. I will start by saying I am confident that disclosure that had to be read this morning, a lawyer made them do that. I'm confident that that's how that happened. Those doggone lawyers. Cammie, it's wonderful to be here. To our friends at Mercer, it's wonderful just to be back. And yes, it would be great to get back to college, although I don't know that I could ever get into the Mercer Medical School. So I'm just very grateful that y'all would have me here as a guest, because I think that's about the best I can do. But look, I want to thank Cammie and the entire team at CWC Alliance for your resounding commitment to fighting the opioid crisis in our state. I cannot tell you what an honor it is to be here yet again with a group of folks that are just fighting. And I've known Cammie and her husband, John, for many, many years. And let me say this, they are warriors, absolute warriors. They have turned their pain into purpose, helping to ensure that no other family has to experience the heartache of losing a child to opioid misuse. And the work they've achieved is nothing short of incredible. Just look around this room right now. It's their mission, their strength, and their resolve that's brought all of us together today to learn from each other, to seek solutions, and to end a crisis that's stolen far too much promise and far too much potential from the world. Folks that could be changing the world today. It's Cammie's book, The Flight, that inspired countless families overwhelmed by grief to share their stories, recognizing that this isn't a crisis that affects other people. This is a crisis that affects all of us. It's the Christopher Wolf Crusade Alliance that's fighting every day to prevent opioid misuse before it even begins, helping to advance education and pain management and mental health support, helping to ensure that we eliminate the current opioid crisis and that we never experience another one like it ever again. Christopher's legacy is saving lives. Cammie and John are saving lives, and I cannot thank them enough for letting me be a part of their journey. But I also want to thank Dr. Summer and Dr. Elkins, the Mercer University School of Medicine, and the Georgia Rural Health Innovation Center for sponsoring this very important and timely event. I also want to thank my friend, Representative Matt Hatchett, for being here. Matt is in the House of Representatives. He's the chairman of the Appropriations Committee, and he has been a champion fighting for us for economic development and in our office at the Attorney General's office, and so grateful that he's here today as well. And I continue to hear from partners in law enforcement all over the state, particularly in rural areas. They're desperately in need of recovery and prevention services, and we appreciate all of the work that you all are doing to expand access to care in all of our communities. And I want to thank the physicians and the healthcare professionals, the counselors and the social workers, and all of you that are advocates that are here today. Grateful for the work that you do to bring hope, healing, safety, and restoration to those struggling with addiction, our friends in recovery, and the families that are in search of solutions and support. So no matter where I go in the state of Georgia, when I talk about the opioid crisis and and ask who all have been impacted, nearly every single hand in the room is raised. Whether it's the high school athlete that was prescribed opioids for the injury, or maybe the teammate that got the opioids because the guy got injured playing lacrosse, as I met at Kennesaw State, or the parent who's struggling to make ends meet while dealing with chronic pain. It's a crisis that knows no economic, geographic, or demographic boundaries. This is a health issue. It is a public safety issue. And most importantly, it is a human issue. But no one person is the solution, and no one idea will erase the pain, the heartache, and the struggles. It's a multi-layered crisis that requires a multi-layered solution. And that's why when taking office in 2016, I made it a priority to dig deep into this issue by collaborating with fellow attorneys general and others in the public, private, and nonprofit space. Most importantly, I heard from Georgians who experienced a loss firsthand, and I keep their photos next to my desk in my office as a reminder of the devastation that this crisis has caused. It's through these conversations that I realized that we were still too often combating the problem not in unison, but rather in silos. While well-intentioned, we were each still looking at this national crisis through a different lens. It's prevention or rehabilitation, legislation, law enforcement, workforce, or healthcare, just to name a few. So we set out to make a change by creating a first of its kind statewide opioid task force back in 2017. So we thought if we could get everyone together in the room to share what each other is doing, we could leverage our strengths, our assets, our resources, and our collective experience to more effectively fight this battle head on. And today, our task force serves as a national model, with more than 300 partners who are working together to save lives, as Cammie said, including her and the CWC Alliance, my friend Jeff Breedlove and the Georgia Council for Recovery, and so many of you that are in the room today. But we didn't stop there. As Cammie mentioned, we made clear that we weren't going to hesitate to go after those who have profited off of other people's pain. We did have that Savannah doctor that we prosecuted who was prescribing massive amounts of opioids to patients that he knew were struggling with addiction. And we also took action against the pharmacist that was filling those scripts without question. We also understand the difference between those that we're mad at and those we're scared of, and we're trying to get help for those that we're mad at. You all in this room know better than I am, but there are far too many Georgians across the state who aren't sure where to turn for help. There are organizations doing great work from recovery to prevention to education, and they're actively seeking additional resources to expand their efforts and reach even more communities, particularly in our rural parts of Georgia. We've also heard from law enforcement officers who are arresting the same people over and over again, not because they're not committing crimes, but because there's a lack of addiction and treatment services in the state. Our jails are not mental health facilities, and they are not recovery centers. We need real care that's accessible to all Georgians in this state, no matter where you live. And thankfully, help is on the way. Over the years, we've taken action against those who contributed to the opioid crisis in the first place, filing lawsuits and joining several national settlements with more than 20 manufacturers, distributors, and retail pharmacies. And as Cammie mentioned, as a result, we have been able to secure more than $1 billion for our state and local governments to expand and strengthen critical treatment, prevention, and recovery services for every one of our communities. These funds will be received and distributed over time, with roughly 230 governments, public service entities, hospital associations, sheriff's offices, and community service boards positioned to receive financial relief, including rural cities and counties throughout our state. Many of these funds will be distributed through a competitive application process that's overseen by the Georgia Opioid Crisis Abatement Trust, chaired by Commissioner Kevin Tanner. And Commissioner Tanner, as you all know, leads the Department of Behavioral Health and Developmental Disabilities, and his team and him are just incredible partners in this fight. And I know you're going to hear from him later today. So if you have any question about accessing the funds, please ask him or the team that's here, and I know that they will help you understand the process. But it's important that we spread the word about this funding opportunity so that we can ensure all of our partners who are doing great work in this space have the opportunity to apply and receive additional resources so that they can reach even more Georgians. There's no doubt that the opioid and overdose crisis has transformed over the years. And today we are facing a crisis that we've never seen before. The war on fentanyl is one of the great public safety challenges facing our nation, with more than 22,000 pounds of cartel smuggled fentanyl seized just during the last fiscal year alone. And we mentioned the Augusta operation that we have, but the 22,000 pounds of fentanyl that were seized at the border, that is enough fentanyl to kill the American population 14 times over. Think about that, 14 times over. And I'm just going to say this. If we knew that a foreign country was going to come here and kill the American population once, we'd go to war. That's what we're talking. We ought to be mad about this. We've got to do something about it, and we are. And that's where our gang prosecution, thanks to the legislature and the governor, we're in the fight, and we're doing our part. And that Augusta operation is just so important. Think about this. 15 pounds of fentanyl, can kill 3.5 million people, a third of the population of the state of Georgia. That was just one operation in one city, in one state in the United States. Just one. But I'm proud of what we're doing and what we're going to continue to do. But think about that 15 pounds of fentanyl another way. That could have ended up in the hands of someone's child, their friend, their parent, your coworker, and they could have been gone forever. And just this week, we're announcing a new indictment here in Macon where we seized a significant amount of cocaine, ecstasy, and fentanyl, and we're prosecuting more than 10 individuals who are alleged to have run a drug trafficking ring from a local jail. Now, I won't get started on cell phones in prisons, but fortunately, we've been fighting for this, and the federal government's now going to allow states to jam cell phones in prisons, and that is a big difference in our state, and that's what I'm proud that we've worked on that as well. We also pushed for the passage of the Halt Fentanyl Act, federal legislation that classifies all fentanyl analogs as Schedule I drugs, so that we can close a loophole that has been far too often used by drug dealers, and to ensure that they are prosecuted to the fullest extent of the law. Now, this legislation was critically important because, as you may know better than I do, we went from 0 fentanyl analogs in 2012 to 67 fentanyl analogs in 2017 to 266 analogs as of last year. That's 266 versions of a drug that will kill you, and each version was more powerful and more deadly than the last. Let me be clear. The era of recreational drug use is over. And every parent and every child has to understand this. When you buy a drug from a drug dealer, you're literally playing Russian roulette with your life. And that's also why we partnered with Mike and Angela King O'Kelly, whose son Jack died in 2023 due to fentanyl poisoning. It was the day before Thanksgiving. Jack went out with his friends like he always did, but by the next morning he was found unresponsive, having already passed away from taking a fake pill. Jack's story is tragic, and our hearts break for his family, but it's also been a call to action for his family. Mike and Angela formed the Jack O'Kelly Foundation soon after Jack's passing to educate high school and college students, athletes, and Greek life members about the dangers of illegal drugs and fentanyl-laced pills. Just last year, we worked with them to host an event at the University of Georgia for incoming freshmen. We filled every seat in the room with Jack's friends and classmates who I firmly believe left that visit more informed and far more equipped to care for themselves and those around them. I'm telling you all, as the father of a college student, this is the issue that keeps me up at night. And I am so grateful for Cammie and Mike and Angela and John and so many others that are doing so much to shine a light on this crisis. Because with their help and the help of all of you in this room, Georgia will continue to lead the nation in this fight. So as I close, oh, there you go. I'll take a round of applause for that. So as I close, I want to once again thank Cammie, CWC Alliance, Mercer, the Rural Health Innovation Center, and all of you here for your steadfast partnership. When it comes to accessing care for addiction and recovery, the difference can be life and death. By leveraging our knowledge and resources, we can better support those who are struggling and be there for families who are in desperate need of help. We can strengthen our workforce, and we can uplift every single one of our communities. And we can talk about these issues, overcoming the stigma that often stands in the way of healing. We're proud to be a part of this effort, and we're grateful for the work that you do each day. So let's make a commitment to each other. Let's change the world. Let's say that we will stay in this fight until there are no more deaths, there are no more tears, and there are no more heartache as a result of this opioid crisis. And with that, I'd be happy to answer any questions y'all may have. Unless it has to do with the disclosure. I have no earthly idea.
Can you expand on the Halt Fentanyl Act's anticipated impact in Georgia?
Yeah, it's going to allow our federal prosecutors and federal partners to be able to go after those that have said, well, it's not actually, and as I understand it, and this kind of gets beyond me scientifically, but it was a crime to have fentanyl, but it wasn't a crime to have an analog of fentanyl because it was kind of defined scientifically. So this kind of makes the expansion. It'll allow us to have another tool in the tool shed. And by the way, if you're a drug dealer and you know that drug is laced with fentanyl, you need to be prosecuted for murder if somebody dies. Plain and simple. Plain and simple. Yes, ma'am.
I'm just curious how you're working on changing the mindset in the legislature. Are you educating the legislators because they need to make the laws good?
I find them, and there's one in the room, so it's going to make me look really good. I find that the legislature is very, very receptive to what we're doing. Look, when you have a crisis, again, it's like every room. Every single person I know, they're either struggling with addiction, their family member, their friend, somebody is impacted by this. If this isn't a kitchen table issue for every Georgian, it's a kitchen window issue. You see it, somebody close. We don't have a problem as far as I'm concerned in the legislature. We don't have a problem with the governor. We don't have a problem in our office. I think the biggest challenge is kind of what I said was the reason we started the opioid task force to begin with, communicating. Just think. If we could take all of this intellectual horsepower, if we could take all of this passion, if we could take all of this experience and make sure we're communicating, that's that war that I'm talking about. That's the war we have to declare on fentanyl. And the legislature's a great partner in it.
Thank you.
I was hoping to hear something about what I've heard is gas station heroin. It's kratom and some other stuff that's being sold. You can just walk into a gas station and get it. I'm working with a couple of patients now and they say it mimics 10 times heroin.
Yeah, no, that's complicated. There's no doubt that's complicated, and that's an area that we all need to continue to focus on a little bit more. I'm just going to leave it at that. But I will say, again, that's starting to become more and more of a kitchen table issue. It's a kitchen window. I mean, it's kratom, it's Delta 8, Delta 9. I mean, it's a complicated issue, but that is an area that we're I think at the front end on from a public policy perspective, and we need to continue to focus more on.
Hi, Mara Shankar. I'm the CMO of CWC Alliance. I have a question for you.
Sure.
What are your thoughts on pain as a fifth vital sign in terms of hospitals being judged for pain performance, but not necessarily having access to something like a life care specialist?
Well, I thank heaven for the life care specialist, because I think I am not a doctor. I am a business major with a law degree, so I'm the last guy that needs to be practicing medicine. However, I can have an opinion that I do think that it's critically important that those that are the experts be at the table to talk about this. And great public policy is we create better policy when we're sitting around the table talking with the experts rather than we're guessing as elected officials or as politicians. But I think that that's critically important. And there's no doubt that people struggle with pain. There's no doubt you can go too far. There's no doubt that there's alternatives. But if people don't know that, then that's the challenge. Then we get into the problems. But the more we have folks that are going to be talking about it, sitting down with patients, with a medical professional, to me, that makes a whole lot of sense. So I'm a relationship and communications person. The more communication we have, the better off I think we're going to be. Any other questions? Well, let me just say this. Keep fighting. Be a part of the war on fentanyl. Let's get over that stigma. And God bless each and every one of y'all for what you do. Thank y'all.